Hello, my name is Rebecca Summers. I'm a PhD researcher at Swansea University, and I'd like to talk to you today about the project that I'm undertaking as a part of my PhD, which involves working towards identifying the right values to measure to support value-based healthcare in cancer care. Collaboration in research can be challenging at times, but is important in driving forward innovation within Wales. Therefore, collaboration between the NHS and universities is vital so that the health setting can benefit from this innovation and experience significant benefits, including social and economic, to name a few. Collaboration is at the heart of this project. On the first level, it is between Velindre NHS Trust, specifically Velindre Cancer Centre, and Swansea University, which is facilitated by the funding of KES2. On a further level, this project has marked public collaboration within the various stages of the research cycle. Further details of the public involvement within this project can be found on the project page on the NIHR Involve website, a link to which I'll provide at the end of the presentation. So moving back to the context of the project, there is increased demand upon the healthcare service almost globally, in the light of an aging population, increasing chronic disease prevalence, rising comorbidities, and the development of increasingly innovative treatments and technology entering the setting. This is particularly evident in services for people affected by cancer. It is estimated that 1 in 2 people will develop cancer at some point in their lives in the UK. However, given the scarce resource environment of healthcare, this channeling of funds to meet the demand on services for people affected by cancer may leave other services underfunded or indeed unavailable to those that need them. To ensure this does not continue, a fundamental change was enacted in the way healthcare services were delivered in Wales, with a focus upon developing a more efficient and effective service. This took the form of prudent healthcare. More recently, the application of value-based healthcare is being seen as a way of delivering the prudent healthcare principles in a measurable way. The value-based healthcare approach acknowledges that high value does not have to mean high cost. Instead, it embraces that simpler actions done consistently can provide the highest value. Healthier Wales outlines that a key principle to achieving higher value in health and social care is ensuring that care and treatment is designed which enables individuals to achieve what matters to them. As a part of this, it's necessary to measure the aspects of services that are indeed valued by individuals. Velindre Cancer Centre is working towards a more sustainable yet person-centered service through the development of new methods of patient education that facilitate individuals to become equipped with the knowledge, skills, and confidence they need to manage their own health and healthcare, i.e., more activated patients. However, this brings several questions to the forefront. What aspects of these services are valued by individuals, and thus the aspects we must ensure we measure so we can work towards achieving higher value in health and social care? Who are the key stakeholders we should involve in this discussion of values? And how do we go about building this measure? Firstly, who are the key stakeholders we should involve in this discussion of values? An initial stakeholder mapping activity at the start of this project helped to identify the key stakeholders to involve in this discussion. It's important to remember that an individual patient does not go through their journey alone. They are more than their illness, and others will have a big input into their journey. At the centre, yes, indeed, there is the patient. However, their family and friends may also be integral to their journey. Therefore, it's important to consider their viewpoint on values too. The healthcare service is a public institution. Therefore, it would be remiss if the public stakeholder perspective was not additionally explored. Finally, healthcare professionals obviously have a marked impact on the patient. Therefore, it's essential to explore this perspective, but to be mindful that it does not overwhelm or direct the patient voice. To answer the question of what aspects of this service are valued by individuals, and thus the aspects we must ensure we measure, we devised a sequential mixed method study to develop an evaluation framework based upon key stakeholders' values that can be used to assess the value of future patient education and activation in cancer care. The study consists of an initial qualitative phase involving semi-structured interviews with patients, carers, and members of the public to explore value and patient education from their different perspectives. Convenience sampling from within breast and lung cancer treatment and follow-up clinics at Velindre Cancer Centre will be used to gather a sample of 15 to 20 patient and carer participants. Again, convenience sampling from registrants of Healthwise Wales was used to recruit 15 to 20 members of the public. In addition to this, electronically captured data regarding patients' experiences of Velindre's new patient education approach will be captured by Velindre, and this will be used as secondary data in the study. Thematic analysis will then be used to analyze the interview transcripts and secondary data. Patients, carers, and members of the public will be able to consent to take part in either only Phase 1 of the study, only Phase 2, or both Phase 1 and Phase 2. The thematically analyzed Phase 1 data will be used to generate a set of value statements in relation to patient education that will form the first round of electronic questionnaires, which are to be part of the modified Delphi method, which is in Phase 2 of this study. During this phase of the study, I'll be looking to bring in the healthcare professional perspective alongside the patient, carer, and public perspective. I will use purposive sampling of healthcare professionals from within the cancer centre to obtain a sample with expert knowledge and experience of patient education in cancer care. The patient, carer, public, and healthcare professional participants will complete 3 rounds of electronic questionnaires in order to reach a consensus regarding value statements in relation to patient education. This will be followed by 3 consensus workshops for which convenience sampling from individuals registered to attend public involvement events run by Swansea University and Velindre will be used to obtain the public participants. For Phase 2, consensus will have been deemed to have been reached when there is 75% of agreement between respondents. The findings from this second phase will then be used to guide the development of an evaluation framework, namely a measure, that can be used to assess the value of future patient education and activation interventions within the cancer care setting. This measure will support Velindre in providing a service that is more in line with patients' and further service users' values, enabling them to deliver a quality, value-based healthcare service for patients. Currently, the study is within Phase 1. However, once complete, this study will demonstrate how key stakeholder values can be identified and used to develop evaluation frameworks for healthcare services in Wales. It will support services in becoming better at measuring what really matters to people, thereby facilitating the movement towards efficient and effective quality services to achieve a healthier Wales. Thank you for listening. If you have any questions or comments, or would like to talk further about the study, please feel free to contact me using the details provided on this slide.